Hello, my name is David Trupin with Body by Dave Fitness. Today I'm going to be covering how to fix and eliminate pain in your hands. Today I'm going to cover a number of tools and techniques to source out and eliminate any tightness, stiffness, or even pain you might be experiencing. The first tool today we're going to be covering is the massage gun, which is also known as a percussive therapy device. So how this works is it basically uses rapid repetitions to stimulate blood flow to soft tissue trauma, tightness, inflammation, adhesions in the muscles, to basically loosen up and break up any inflammation in the hands. It's pretty straightforward. So today we're going to cover how to eliminate this with a massage gun. Will be our first tool we'll be covering today. You can use one of two attachments. I highly recommend starting with the soft tip ball, and then from there you can work your way to a smaller fine point tip on the massage gun. And so we're going to start with the soft tip, which I tend to use for the most part. Sometimes if you need to get in deeper in the fingers, you can use the finer tip, or into the base of the thumb where there's more soft tissue and the soft tip doesn't necessarily get deep enough in there to loosen things up. So how this is going to work, you're just basically going to start by turning your device on. I recommend usually using a higher repetition rate, and then just basically applying less or more pressure, just to basically stimulate more blood flow, and so it doesn't kind of bounce and vibrate. It tends to allow you to loosen things up a little faster and a little less painful if you just basically change the amount of pressure and just hold it gently off the skin, and then as it loosens up, work deeper into the soft tissue. So we're going to start with first is basically just turning it on to higher rep range, as high as you can. So for my gun, it goes up to 6. Okay, this is just one you can buy at Costco, a sharper image, like 80 bucks. Starting at the base of the thumb, we're going to start very down at the bottom, and we're just going to kind of work our way through any little tender or tight spots. And so as you hit tender or tight spots, they tend to be, well, one, you may feel it more, and two, it just tends to be louder. So it's kind of like hitting a more resistance essentially. And so how this is going to work is as I work my way up, you're going to kind of hear as I hit some of those tender or tight spots, like right here, you can kind of hear it a little bit louder, versus when I'm going into areas that's a little less tight, it'll be a little quieter. So just by moving your way around the soft tissue, you'll kind of find tender or tight spots. And so whenever you find those tender or tight spots, you want to sit on them until they basically dissipate. However long that takes, might take 30 seconds, might take a minute. Just kind of inch by inch, just kind of go through, find and source out any of those tight spots, and starting at the base of the thumb, and you can kind of work your way in and around the thumb. Okay, as I'm just kind of doing so, and then you can just kind of get from the top part as well, which most people don't realize. A lot of your tightness in your hand starts at the base of the thumb here all around. And so inch by inch, we're going to kind of work our way around the thumb. Okay? And so how this is going to work is you're just kind of looking for any tender or tight spots, okay? I'm just trying to help stimulate blood flow so you almost feel like a warmth sensation, stimulating more warmth and like fresh blood going in there. And then we're going to kind of work our way back around the thumb, and then just inch by inch, you're just going to kind of work your way around the hand. Anywhere you find tender or tight spots, whether it be near the knuckle, okay, or in the middle of the hand, okay, or down near the palm, okay, bottom of the palm. And so we're going to just kind of gently work our way through, just methodically, up, down, side to side, change angles, just to kind of get into those little crevices, because you have a lot of soft tissue and bones and muscles in your hands. And so after you've kind of loosened up the palm, you're going to kind of work your way up individual fingers one by one, just kind of gently. As you can see, I'm not really holding it, pushing too hard on it, just enough to stimulate a little blood flow in there. Okay, looking for any little tender or tight spots. Okay, most of it tends to be further down the finger, but everyone's different as far as where they have tender or tight spots or inflammation. And then just kind of working my way around each finger. Okay, gently and slowly. All right, you don't have to go too crazy, and most of it's going to be at the bottom, not at the top of the finger. And then just going to kind of work your way around the hands until you've gotten all these little tender or tight spots out. Okay, and then once you're done, you're going to turn that off, and you can switch sides to the other hand. Same exact thing, just kind of source your way around. Hope this helps as far as the first tool, and then we'll cover the other tools in later part. Next tool we're going to be covering today is lacrosse ball. simple handball, rubber, little firm, not too bad. So with this, we're going to basically use the same principles as the massage gun. We're going to start by taking the ball. We're going to lay it. You can just lay it on the bench today, or if you want, you can also use a firmer surface on the floor, on a table or hard surface, or even a desk. And so with this, you're going to basically just start by just kind of gently massaging, rolling around. That's just usually same thing. Start at the base of the thumb, working through any tightness or discomfort or basically painful spots with the ball. You tend to get a little bit more pressure if you can use a firmer surface, but the bench works just fine if you need pressure. You can just kind of lean into it or even stand over it if you need more pressure. It doesn't take much to kind of dig in there. And so yeah, just going to kind of methodically roll inch by inch around the hand, and then you can kind of work your way up into the fingers. The ball doesn't necessarily get the fingers as well. Usually if this doesn't work, you can use a golf ball as well to kind of get into those deeper spots as well, which we'll cover as well, but you can just kind of dig in there, getting into the fingers a little bit better with the golf ball, and a little bit nooks and crevices a little bit better in the base of the thumb, just to get a little bit deeper pressure. But yeah, so also with this, you can also use it pushing one hand against the other. You can kind of even use it on the outside, putting pressure on it with the other hand, just kind of digging in there. Same thing with the golf ball, gets into those crevices a little better. Just kind of dig in there inch by inch and just kind of apply pressure as needed, digging through any tight or tender spots you might have. Hopefully this helps. If you have any other questions, also feel free to comment and respond. The last tool we're going to be covering today is using our own hands. So simple enough, you're going to take your thumb or even index finger or both, and we're going to dig in to any tight or tender spots throughout the hand. Now obviously if your hands are pretty tight, try to use the other tools first so you're not making your hands tighter, fixing one problem, creating another. But yeah, if your hands aren't too tight or just one hand's tighter than the other, you can also use this if you don't have the lacrosse ball, golf ball, or massage gun mentioned earlier. So last but not least, we're going to cover is just basically just digging into the soft tissue. So like I said, you can either use mostly your index finger or, like I said, even your thumb to dig in and find any little tender or tight spots. Same thing, you're just going to apply light to moderate pressure. If you don't find anything, you can kind of put a little deeper pressure till you find and poke and find any distortion patterns or tightness in the soft tissue, okay? And so anywhere you find tender or tight spots or things that feels a little discomforting, you want to just kind of apply light to moderate pressure, okay? In there like so until you basically feel it relieve, okay? Dissipate, or even just kind of almost feel like a warmth sensation going in there. Pretty straightforward. You just basically go throughout your fingers as well. Same thing, just kind of applying pressure. Most of the tightness will probably be along the bottom portion of your finger. Okay, you can also along the outsides as well, might be a little tight, but most people's pain and discomfort comes from the muscles and tendons along the finger on the inside that tend to cause more tightness and stiffness in the hands. And yeah, so hopefully that helps. If you have any other questions or concerns, please feel free to comment or message me directly. You can also find more tips and other fun facts on my website at bodybydave.com or at bodybydavefitness on Facebook or YouTube or other social media channels. Thank you and have a wonderful